So just we can break down into 3 points. What AI can do in healthcare? AI can make fast diagnosis, which can save time, and which can make an early diagnosis, which will give a good outcome in patients, and it can save time by making academic records, by keeping academic records to itself, and it can tailor treatment by looking at the reports of personalized reports of the patient with his comorbidities, and make treatment, tailor treatment according to their academic conditions. So AI can enhance the diagnosis. They can save AI can save time, and we say time is brain, and so it applies in every field in medicine. Like if we detect as a cancer tumor which is in early phase, within 1 or 2 centimeter diameter, it can be, even cancer can be cured with time. So, and it can personalize the treatment plans of the patient by looking at the comorbidities of the patients. As I said earlier, it can go through the emergency medical records of the patient, genetic information of the patient, and we can tailor the treatment of the patient according to the individualized treatment can be given within minutes, because it takes a lot of time to go through the history and total genetic information in the patients. It takes us hours, but it can do in minutes. And most of the doctors and medical professionals, they spend their times keeping medical records for medical legal purposes. It can take that administrative works like making appointments, billings, and other records can be done by AI, and we can dedicate more time in patients, so we can give better quality care to the patients with AI. And as I said, wearable gadgets we can monitor the patient's vitals like heart rate, ECG, and other vitals like blood sugars in real time from remote distance, so that we can monitor our post-operative and pre-operative patients. We can prevent the complications. We can prevent unnecessary complications and hospital administrations by looking remote monitoring of those vital parameters of our patients. And in the context of our country, where transportation and we don't have adequate healthcare personnel in remote areas, telemedicines can do a good job, and that is being done by teleconsultation. And even in the world, telesurgery has been started in few instances. So what AI can do is we can make a future-ready healthcare. Like in 2019, before COVID era, we were not prepared for the massive pandemic. But if we incorporate AI in healthcare, if we incorporate healthcare in our healthcare system, we can manage COVID pandemic with pandemics which we can treat patients with high volume, and we can in future we can pay for better efficient management of such pandemics in future. So I will talk about the independent departments, what AI can do. You can imagine how a radiologist works. He sees more than 500 X-rays in a day, 100 of CT scans in a day. He is a human being, so his eyes can get fatigued. But if we generate, if we can feed AI to the system, because our systems like CT scan, X-ray, and C-arms are all digitalized, and they give us digital image. This digital image can be scanned within minutes by AI, and they can at least scan and triage the normal scans, and there in certain instances like human error are more prone. Like in X-rays, human cannot detect certain small masses, long masses, or in CT scan, bone metastasis. These are the errors which can be done by human eye, but AI protocols, AI generated, AI powered protocols could detect them early, and they can inform the concerned radiologist. Like it is like adding two sharp eyes to the radiologist. in pathology, even pathology can be digitalized because pathological slides, histopathological slides, smears can be scanned and they can be digitalized and they can be zoomed in and zoomed out and proper diagnosis, better diagnosis can be taken out in pathology. And there is already a wave microscope, that is computerized microscope, where we can feed the digitalized images to the wave microscopes, and they can give probable diagnosis, possible pathological diagnosis in such cases. So, coming to surgery, because in surgical robots, they are powered with AI, they are highly dexterous, and they are fatigue and tremor free. Because as human in long surgeries, they do not, the human beings, when surgeon operates for more than 6 hours, 7 hours, even in neurosurgery, they can get fatigue. They usually get fatigue, and we need a team of surgeons, of 2-3 surgeons to operate on for such long surgeries. But even our hands get tremors. But these AI powered robots, which has been already been launched, they do not get fatigued. They can work for long hours, and they are tremor free with good precision. These are the primitive models of robots which have been launched for suturing, and this is Raven 2 surgical suturing robots and PR2 robots. These are basic robots, but this is the Da Vinci robot which has revolutionized the surgical field. Da Vinci robots in 2003, when I entered into my medical career in MBBS, robotic surgery would feel like a science fiction for me. But today, it has been incorporated in many international hospitals. The Da Vinci robotic system, it mimics the hand movement of the doctor, like in this figure. The surgeon is sitting without scrubs in the Da Vinci robotic system, and he is moving the cursors, joysticks, and the assistant and the robotic arms. There are 6 to 8 robotic arms there, and he is performing the surgery sitting away from the patients and the assistants. And nowadays, this distance has been more increased. A surgeon in Germany can operate a patient even in Dubai. And as surgery needs anesthesia, there are certain boards which can perform anesthesia, which can help anesthesia. They detect EEGs in the frontal cortex of the patient, and they take the biofeedback like pain and muscular relaxation levels, and they infuse the propofol and other anesthetic drugs into the patient. This makes automated anesthesia robots. And this is the robot Bank Sleepy. It is really a name of a robot. And nowadays, dermatological conditions, like certain dermatological conditions, patients just can click their dermatological lesions and update in the softwares like Derm Engine, Skin 10, and Skin Vision. So these robots can give probable diagnosis and even the probability of malignancy, early malignancy. So in the setup of rural areas where healthcare is not approachable, in rural areas, this app can help in diagnosing skin conditions early. So let's summarize. The artificial intelligence even in clinical trials, this artificial intelligence can play a role to deliver good drugs early by helping in clinical trials. Like they can give us data access in by remote monitoring, and we can monitor the harmful effects in the patient, in participants, and we can conduct the trial or stop the trial in that condition. These are certain apps which were developed earlier in 1986 in the University of Massachusetts diagnosis plane, which can help in diagnosis by symptoms, and John Watcher, which can help in diagnosis of ICU-based infections. And there are many apps which has been developed in the in different continents and in the world, which are reshaping the healthcare services. Even our smart watches like Fitbit and Apple, they have different functions, even ECG functions incorporated in them nowadays. So this comes to be important, that what is brain-computer interface? Brain-computer interface, let's imagine that a patient is paralyzed, who cannot talk, who cannot move a bit. He thinks, by his thought, he will move a cursor in a computer, or he can move a robotic arm. So this is brain-computer interface, where there is an implant, which very fine implant, which is based in the motor cortex, which is implanted in the motor cortex, and this implant will directly connect with the other devices between the brain and external devices. So this Neuralink company has, by Elon Musk, has been developing that implantable device, and it has implanted one device. There are many possibilities in this field. Like not only the paralyzed patient, we can augment our sense organs. Like we can augment our vision, we can augment our thoughts, we can augment our memory with these chips if it gets successful. If it gets good result in its initial instruments. Why it matters in neurosurgery? Because brain-computer interface, it needs surgical implantation. Neurosurgeons need to implant such interface in the patients, and there is a potential future for neurorehabilitation, augmentation, and cognitive enhancement. So I will be discussing certain AI-based instrument that I have been using since 2017 in practice of neurosurgery. There is a neuro navigation system which we feed CT scan, and we get a 3D brain model in it. And with that 3D brain model and AI enhanced technology, we move along the brain like it's a Google map, but destination is the brain tumor within the brain. So this is the neuro navigation system which we have been using. There is we feed the data, and we do the registration, which gives us real time, and during the surgery, the position where we are working. And this is the OR, where this is a portable CT scan. Where we can do real-time CT scan in the patient, and we can feed the data in the neuro navigation system, and we can mark the position where we are working. And this is the same neuro navigation system. This is the neuro navigation system which we used in Vir Hospital in 2017, and this is the recent version of neuro navigation system which we are using currently in Vir. And in brain-based neuro stereotaxy similarly has a better precision, because it has the precision of even millimeters. So in deep brain stimulation surgeries, like biopsies and deep functional neurosurgery, brain-based neurotaxi is used. This is the stereotaxic frame we put on the patients, and we go for a CT scan with this stereotaxic frame, where we mark the different points of brain, and this frame, the complementary frame, is added inside the operating theater, and we navigate with the AI-generated protocols, looking at the safe zones in the brain, safe trajectory in the brain, and we reach the like globus pallidus or midbrain, or any biopsies, deep-seated biopsies can be done with a small borehole with a very fine precision. And we also have intraoperative neuro monitoring. During surgery, intraoperative neuro monitoring system, this is a case of facial tumor, auditory nerve tumor, where we have placed the electrodes in the facial nerve zones. And during the surgery, if we touch the facial nerve, if we are going to damage the facial nerve, then the system, neuro monitoring system, it alerts us. It says that you are near the nerve, and it prevents us from the disasters intraoperative and postoperative morbidity and paralysis. So nowadays neuromicroscope, we operate in neuromicroscope, but they are not only magnifiers. They are AI incorporated neuromicroscope. They can identify the nerves, vessels, and they can even identify the tumors. They can integrate it with neuro. They can be integrated with the neuro navigation system, and we can identify in the real time with the microscope. That microscope will say that we are near close to the tumor margins. Like it is like having a smart and genius assistant with me, assisting with me. And these are the CT scans and MRI which we are using. Our MRI is not AI powered right now, and CT scan is also not fully AI powered, but it is partially AI powered. At least it can, if we feed the data that we are going to do a head CT scan or an abdominal CT scan, it will do the rest of the jobs of doing a CT scan by itself. So it is just about partially AI powered CT scan. It does not do reporting currently. So there are certain benefits for physicians because it is a good assistant. It can make. I will complete it earlier. So there are certain challenges like there are privacy issues. Already says that it is already said that in ethical issues that there are accountability issues. If the machine does itself, if the machine starts doing everything itself, then there will be question. Further, there might be complications. Then there will be complications of legal complications that who will be responsible, who will be accountable. There are bias and in training, in our curriculum, we don't, medical students don't learn about anything about AI and about any instruments in our study. So after doing, we do and learn AIs, and we do. So I think it is necessary to put AI and other things in the academics also in MBBS and medical curriculum. I would like to begin my presentation by saying once a person is a famous neurosurgeon, he said that human brain is most complex structure in the universe, and the challenge of neurosurgery is not just the precision, but so AI can enhance the precision, but AI can never take over the precision for a few years. So the surgeon is only the heart of the surgeon. But AI can be the brain of the surgeon or procedure, but surgeon is only the heart of the surgeon. So there are certain challenges in our country, like we have no data sets to compare the data, and we have opportunities. We have medicine and surgery which can be done in our rural setup. So take home message. I would say that AI will never replace humans or neurosurgeons, but neurosurgeons use AI may replace don't use. So I think it applies to everyone, every field. So I think it's better to everyone of us to sit on the right side of the future.
Here.